Sequential aligners are custom-made devices designed to gradually move teeth into their desired position. They are crafted from thermoplastic material, and through a series of progressive aligners, they apply gentle and controlled force to the teeth. Each aligner is engineered to achieve a specific movement, typically over 2 weeks intervals. This is made possible through prior digital planning, where the entire treatment process is simulated from start to finish. Almost all cases that can be fixed with brackets can be fixed with dental with aligners, clear aligners, such as dental crowding, excessive spacing, cross bites, open bites, deep bites. Even some difficult cases, sometimes with some additional procedures, such as screws, or sometimes elastics, or sometimes other type of appliances can be used to reach the result we want. Almost anyone can have clear aligners, but the ideal patient will be a patient with mild to moderate alignment issues, obviously with good oral health, and free from cavities or some periodontal disease. Obviously, we want a patient that is committed to wearing the aligners for at least 20 to 22 hours a day. And obviously, a patient that wants some discrete and aesthetic solution. Like I was saying, even complex treatment can be treated, but we're saying the ideal patient. Those are the points we're looking for. Okay, first of all, there are more aesthetics. Aligners are nearly invisible, making them a preferred choice for patients who want a discrete orthodontic treatment. They are more comfortable. They fit perfectly on the teeth. They can be removable. They are removable. Liners can be easily removed for eating, drinking, brushing teeth, flossing. So it makes oral hygiene simpler and more effective. The dietary restrictions are much less than brackets. You can eat almost everything with aligners. We have a predictable movement because we're planning beforehand. We know where the teeth are moving, so we know the ending before we start. So they are more predictable than brackets. We have also shorter appointments. Usually, when the patients go to the office, we usually see them and make a little adjustment if needed. Usually is, how are you? You're doing very good. See you next month or 2 months. The hygiene is much easier than brackets, and it's much cleaner. So if patients have issues with the cleaning, the problems are much less with aligners than with brackets. And we also have a reduced risk in emergency, so no loose brackets, no wire problems, or so there are no things like that. And it's a much more comfortable, and they are customized. So for my point of view, they are much better than brackets. Aligners are typically changed every 2 weeks, depending on the orthodontist recommendation. But for me, almost all my patients are every 2 weeks. Also, depending on the patient's progress, if we see a teeth that is getting is not catching up with the others, we can let the patient use it 1 or 2 more weeks, the same aligner. And the checkups are usually every 4 to 8 weeks. Usually, more 8 than 4. And patients that live on overseas, we can check them with pictures and give the indications through a message, a WhatsApp message, or even an online appointment.